Good afternoon, everyone. Welcome to our session 2 of Making the Healthcare System Work Better for You, Part 2 series. Today's session is Being an Empowered Healthcare Consumer. So in session 1, we learned about the common factors that can cause health concerns and impact our health and well-being, including stress, inflammation, genetics, and lifestyle. And also how stress can impact the body, causes what we refer to as dis-ease that eventually may lead to chronic diseases in the Black community. And then what we can do to engage in self-help strategies to combat that. So today's session builds upon session 1 to provide a deeper knowledge and understanding of how to take ownership of your health and healthcare, or essentially being an empowered healthcare consumer. So why is this important, and especially now? Well, if you've been keeping up with the news for the past few weeks, you know that the One Big Beautiful Bill Act has been signed into law by our current president, and that is a sweeping piece of legislation that will significantly reshape Medicare, Medicaid, and other health programs here in the US that our community has benefited for so many decades. So in the wake of the Big Beautiful Bill, being an empowered healthcare consumer means staying informed about policy changes and what that really means, what's in the bill, how that's going to impact you and your healthcare coverage, as well as your family, actively managing your coverage, so really understanding what changes may happen with whatever type of healthcare you do have, and definitely being better prepared to advocate for you and your family, and using trusted resources and evidence-based information to make smart decisions and understand about all these changes that are happening or will happen. So being able to critically evaluate information and relying on the right information so that you can ask the right questions and advocate for your needs as well as your loved ones is essential in this current environment. So I think it's important for all of us to commit to being an empowered patient, really focus more on being proactive about our health and well-being and preventing things that from happening that are within our control, for sure, so that we can all make the healthcare system work better for us. So today we are very fortunate to have once again with us Dr. Melissa Clarke, who's the author of Excuse Me, Doctor, I've Got What? So this book she wrote to create and teach healthcare consumers about how to communicate, navigate, and advocate for themselves within the healthcare system. So before we start with Dr. Clarke, I'd like to cover just a few housekeeping items. So once I'm done saying a few words, I'll turn it over to Dr. Clarke, followed by a Q&A. So if you have any questions, please feel free to put your questions in the Q&A box. We'll have an opportunity to have some dialogue with her after her presentation. And please note that everyone will remain muted throughout the duration of the presentation and off camera. So before I introduce Dr. Clarke, I'd like to, for those of you who may be new today, give just a brief overview of the California Black Health Network. So next slide, please. So we are the voice and trusted resource for Black health equity in California, and we are the only Black-led statewide organization that works to advocate for all Black Californians. That includes African Americans and Black immigrants of all ages. Next. So we basically conduct outreach, education, advocacy, and policy, as well as programmatic work to advance health equity for Black Californians. And we do that through the lens of understanding the issues that lie at the intersection of racial justice, social justice, and environmental justice. Next slide. Our focus and direction, mainly in the context of our vision, is to create a California where every African American and Black immigrant has the opportunity to live a long, healthy life free from violence, racism, and health inequities. And we work to do that and achieve that vision every day through our mission, which is to ensure that every Black Californian, regardless of how well educated they are, where they live, who they love, how they self-identify, their country of origin, or even their housing status, has the opportunity to access high quality, equitable healthcare, behavioral as well as primary healthcare, and definitely unnecessarily succumb to diseases, and specifically those that are preventable. Next slide. So as I mentioned, we have today with us again as our speaker for the series, Dr. Melissa Clarke. Dr. Clarke is an author, TEDx and keynote speaker, a health show host, thought leader, physician, educator, and population health expert. She's a Harvard-educated emergency medicine physician with over 30 years of healthcare experience, and she's been on the front lines of addressing health disparities, health literacy, and improving the way doctors and patients work together. Dr. Clarke is a medical contributor to the Russ Parr Morning Show. She's made numerous television and radio appearances, including on CNN. Her book, Excuse Me, Doctor, I've Got What, is a roadmap to how to be a smart healthcare consumer and understand why now taking control of your health and healthcare is more important than ever. So based on her book, Dr. Clarke is the host and creator of Excuse Me, Doctor with Dr. Mel, a live weekly health forum on Sirius XM and streamed on YouTube and Facebook, where she provides urgent information and answers audience questions in real time every Monday night at 6 p.m. Pacific, 9 p.m. Eastern. She has served as a keynote conference speaker and has an upcoming TEDx talk entitled Blue Wall, White Wall, Linking Equity in Healthcare and Policy and Policing. She graduated earlier from Harvard College and the University of California, San Francisco School of Medicine, and completed her residency in emergency medicine at George Washington and Georgetown University. So without further ado, I will turn it over to Dr. Clarke. Welcome, Dr. Clarke.
Thank you so much, Rhonda, for that wonderful introduction. I am delighted to be here. And as Rhonda mentioned, the name of my streaming show, which is actually at 5 p.m., we changed the time on you there, Rhonda. It's actually 5 p.m. Pacific, 8 p.m. Eastern. It's called Excuse Me, Doctor, and with Dr. Mel. And so feel free to call me Dr. Mel. That's what most people call me. And I just want to thank you again, Rhonda, for this opportunity. And also in your wonderful introduction there, connecting the dots as to why now, more than ever, it is important to be empowered when it comes to your health, and what you know you can affect in your health, which is what we covered in the first session. And then now, today, we're going to talk about how to be an empowered healthcare consumer, getting what you need and deserve from the healthcare system. And so these are our learning objectives for today, the stuff we're going to cover. So going to lay the foundation with talking about what are your rights as a patient, as a healthcare consumer, when you enter into the healthcare arena to get care, access care, what should you expect are your rights, and also what your responsibilities are. And then to be clear on the importance of patient advocacy, we can't just assume that things are going to fall into place for us because our healthcare system is broken, quite honestly. And so, unfortunately, as the healthcare consumer, just like if you're going to buy a car or enroll your child in school, you have to be vigilant in that process to make sure that you get the best possible product, that your child gets the best possible education. You have to be involved and be an advocate. Same way when it comes to your health care. And it's especially important for people of color. And then knowing how to be empowered, like what are the tools? What are the skills? What do you need to bring to the table to be empowered on your healthcare journey? We're going to talk about those advocacy skills and confidence that's necessary to be successful. So, I'm going to start here. Have you ever had a poor interaction with a healthcare provider? And you can throw your answers in the chat, and I actually just want you to invite you to comment in the chat, put your questions in the chat. We're definitely gonna get to them, leave some time at the end to cover questions. Um, and so either A, never, every interaction I've had with a healthcare provider has been amazing. B, occasionally there are bad apples in every profession. And then C, all the time. Most of the interactions I have with healthcare providers don't go well. I don't know what they're teaching these doctors in med school. So, okay, we're getting a lot of B's I see in the chat. And also too, there was an invitation to put your name and where you're from. I saw initially that we had folks from all the way from Southern California all the way up to Northern California. So great span of participants here today. And so it looks like the consensus so far is B. Occasionally they're bad apples in every profession. And I think that's true, right? I think there are definitely doctors and systems that support doctors in trying to be show up with their best selves to give the patients time that they deserve in each interaction. And then sometimes there are doctors that definitely miss the mark. And sometimes it's the fault of the system in which they work, in which they are they're forced to only give 15 minutes to each patient interaction. They're rushing between patients and they don't have the bandwidth to dedicate to make sure that it's a quality patient interaction. And for those of you who chose you're not alone, who chose B or even C. It turns out that among Black adults, those individuals who say they can trust their doctor to do what's right for them or the community, almost all the time or most of the time, sort of fall out in this way. So about 44% of Black adults trust the healthcare system, 59% trust their doctors. But if you look, younger Black adults are even less likely to trust the healthcare system and their doctors at 35% and 54%. And that sort of gradually increases as you get older. And these are all sort of compared to white adults in terms of their level of trust in doctors and the healthcare system. And unfortunately, across the board, regardless of race, ethnicity, etc., 2 in 3 healthcare consumers report a bad patient experience. Data shows that a more empathetic patient-provider interaction that meets someone's emotional needs could prevent a bad patient experience, but oftentimes that just doesn't happen. So, what are some of the barriers that are making it so that people of color, especially and Black people, are not getting great quality health care 100% of the time? So, we know that some of these reasons have to do with racism and bias. The medical profession and the people in it are no different than society as a whole. So we know that racism and bias exist. We have grown up in a toxic soup of it. And even sometimes ourselves, we don't have the perspective of understanding everyone's equal when it comes to their humanity and the deserving of the best treatment that there is. Um, there are also language barriers as well, especially for the immigrant population whose primary language is not English. When signage and communication occurs primarily in English, there are bound to be gaps that result from that interaction. And then health literacy. Health literacy just means the ability to understand and grasp what is being communicated to you either verbally or in writing. And a lot of times doctors think that uh, taking shortcuts and speaking in quote unquote medicalese makes them sound more educated, unfortunately, or maybe they're just not thinking when they're communicating with patients, that it's important to put it in the simplest language possible and not use a lot of medical terms. Or if you use medical terms, it's important to um, uh, break down what they mean specifically. Um, and so that lack of education that's given by the provider, even though they might be providing good care, you have to be a partner in the care. And if you don't understand what's going on, you can't effectively partner with what the care plan is that you and your provider set up. And then, of course, there is just mistrust that has been earned from decades and centuries of historical abuses of the Black community, from a research standpoint, from a experimentation standpoint. Of course, we know about the Tuskegee study, Henrietta Lacks, and other examples that have, justifiably put um, barriers up in terms of being able to 100% trust in the process. And then there's ongoing current day disrespect. I can't tell you how many times I've witnessed, um, even in my own family interactions, or advocating for friends, when there's just that not that level of valuing everybody's life equally, or according people, patients, the respect that they need and deserve. So those are some of the barriers specifically for people of color. There is good news, though. There are some changes in the healthcare system that are coming down the pike, or have been pushed down the pike, but have not penetrated 100% yet. And that's one of them is looking at whole person care. That means integrating people's care and sort of thinking holistically, combining behavioral health with physical health, screening for social needs. You might have been to your physician's office or the emergency department, and the staff there asked you questions about transportation or food security, or whether you have a roof over your head, perhaps domestic violence, if you use your seatbelt. These are um, ways to where the healthcare system is now recognizing all these things are interrelated. What happens on a social level with you is going to affect your ability to execute on a care plan. So if you have diabetes and you have to take insulin, but you're couch surfing, you're living in different people's houses that may or may not have electricity at any given time, then you're going to have challenges keeping your insulin cold, for example. Or if you're having transportation difficulties to be able to keep up with getting to and from your doctor's office, that's going to have implications for how much you're able to keep up with your requirements for how much you see your doctor. Or if you can't afford your medication, you're not going to take it. So, this recognition of sort of the interrelatedness of social factors, and then of course behavioral health factors. If you have depression, a lot of times if you are diagnosed with depression, or if you even if it's undiagnosed, you don't necessarily have the same motivation to participate in life, to be on top of your health, to take your medications. So undiagnosed depression can be a major factor in your ability to execute on your care plan. So understanding how all these things interrelate, and then working with healthcare consumers, with patients, to make sure that all these things are addressed is something that has been improving gradually. I'm not saying that we're 100% there. We're definitely not. But, I would say actually California is leading the way in really thinking about this sort of integrated model of care. The other piece is, the Affordable Care Act, also known as Obamacare. And, there were a lot of provisions in that bill, and one of the things that people didn't realize, other than it creating the healthcare marketplace where you can buy, a insurance plan if you're self-employed, um, You can just directly buy a high quality health plan. The other issue, or the other thing that it brings to bear is, actually, before I go into that, I want to just briefly pause on, one of the things that Obamacare did was make this marketplace available to everyone. And during the pandemic, the amount of contribution that the government made to make those plans affordable actually went up for people who qualified because they were middle income. And now, unfortunately, we're facing a situation where that additional money that the government was providing has a high likelihood that it's going to go away at the end of the year. And that's going to make it more difficult to buy plans on the marketplace. So just want to flag that again as another reason to be an empowered healthcare consumer, because it's going to be important to understand what your options are if you can't afford one of those plans. Um, but one of the other things that Obamacare that did that was great was to set up a system where um, more and more providers get paid based upon how well their patients do. So um, it's sort of like a layer on top of the care that you get, that if your doctor makes it so that he or she is working lockstep with you, being your partner, helping you address some of the social issues in your life that might be keeping you from improving in your health. If y'all are doing all that together and your health is improving, you're losing weight, your diabetes is under better control, your high blood pressure is under control, you're getting your mammograms and your pap smears and your um, colorectal cancer screenings, your colonoscopies. If all that's happening, then your doctor is actually getting paid more because things are going well with you and with the rest of their patients. So that's really important because we expect that that is going to improve the quality of care. And there's a lot of work going on in that area to ensure that that's happening. So, we've talked a little bit about how to prepare, or what are the changes that are happening in the healthcare system. Now I want to talk about what are some of the things that, when you're getting ready to go in for a patient visit, what are some of the things that you should know? You should know your rights as a healthcare consumer. We're going to go over that. And then we're going to talk about, don't be a quote unquote patient. All right. We'll break that down. Then you got to know what to ask for. Don't go it alone. Know who's on your team. And finally, make sure your wishes are honored. So we're going to go over each of those separately. The first is know your rights. What are you as a consumer entitled to in healthcare? You got to go with that attitude. I am entitled to this kind of high quality care. So you're entitled to respect and dignity, regardless of who you are, having safe and high quality and effective healthcare in a clean and secure environment, and then care that's culturally sensitive to your background and in beliefs. And if you have a different primary language other than English and you want a translator, you are entitled to a translator. So, communication, you're entitled to be informed about your condition, what's wrong with you, what treatment is proposed, what the alternatives are, and what are the risks of that treatment, because every treatment has a risk, including doing nothing, right? And what are the benefits? You have full access to your medical records and you can review them. And if you see inconsistencies or inaccuracies, you can ask for it to be corrected. And you are entitled to understand the bill and get a clear explanation of the charges, what your payment options are, if there's financial assistance available. You're entitled to know all of that. Then let's go down to that next square, autonomy. You should be participating in decisions with your healthcare provider. it's called informed or shared decision making. So the provider should not be making decisions 100% for you. It should be in consultation with you and customized to what you want, what your values are, what your priorities are. You're entitled to file a complaint regarding your care without fear of reprisal and to have those concerns addressed in a timely and fair manner. And finally, you have the right to refuse treatment and to be informed of what those consequences might mean and not be penalized for it. That's important. You should be able to continue your relationship with that provider if you want to, but still sort of refuse that particular the treatment plan that they're recommending. There's risk to that, but it's still your right. And then finally, you're entitled to privacy during medical examinations, during procedures, during any kind of discussions of your medical condition. You might have heard of HIPAA. HIPAA guarantees that privacy of your records and confidentiality, both verbal discussions as well as the written materials, that they only be shared with people that you give permission that it be shared with. So these are your rights. Um, Again, have that attitude of, I am entitled to this because you are. So, because we know that, these are the 5 tips that I'm going to go over in light of those rights. The first is, don't be a patient. So, what do I mean by that? Well, first of all, I want you to sort of study these pictures and, maybe throw in the chat if you're so moved, um, to say, what do you think is going on in either one of these pictures? In the first picture, you have the woman in the blue dress sort of looking off with a certain kind of expression in her face. And then in the cartoon picture on the right, you see, this patient sitting by themselves, with the healthcare providers sort of going off into different rooms, walking away from her. Um, so, right, I see in the chat, the patient's being ignored. Exactly. Um, and a lot of times, these images sort of reinforce the idea of you have to quote unquote be patient. And patience implies suffering, right? It actually, the root word, I love to like look up what the root word of our English common day common language terms are today. The root word for patient comes from the word suffering, right? In the original Greek and Latin. And the idea of suffering actually puts us in this passive mindset. Like there's nothing that we can do about our condition, that we're at the mercy of the healthcare system and we have to sit and potentially be ignored and sit around and wait. But there are consequences if you have that attitude. One is, again, this is all up here, all in your belief system. If you believe that you're suffering, you believe that you're only a patient as opposed to a healthcare consumer, you're less likely to acknowledge your own role in how you can affect your current health condition. The second consequence is, by not speaking up and asking questions and being assertive and being engaged, and asking questions of your doctor, asking and if having that entitled sort of attitude within the healthcare interaction, it might leave you more vulnerable to unintentional mistakes that can occur in the course of your care. And I say that because as healthcare providers, everyone's human, right? And they should be 100% devoting 100% in every healthcare interaction. But the fact of the matter is, and I'm going to say this again later on, the squeaky wheel gets the most oil. And what that means in this context is, if you speak up, if you question, not in a belligerent way, right? But in a way of, I deserve answers, and I want to show you that I am fully engaged in this, as because this is my health, right? Then you're more likely, I think, to get a provider engaging with you, answering your questions, and also being more vigilant. So that's the first tip, in terms of not being a patient, and then those are the two consequences. And now these are some of the things in terms of being assertive and being ready for a healthcare visit. So not being a patient means bringing your list of actual medication bottles or a written out list of the medications you're on, especially if it's your first time seeing a new provider and they don't have access to your patient history. And even if they do, it's great because if you've seen another doctor in the meantime, and they changed your medicine and you're on something different than what that doctor has in the record, it's good again just to make sure that you have the most up-to-date information to provide to that doctor. And that's an example of, not being a patient and not having unintentional mistakes happen because if the doctor knows the stuff that you're already on, they're less likely to prescribe something that might have a bad interaction, for example. And then in order to keep it straight, like especially if you have a complicated story or you have a new problem that's just recently started, it's good to sort of write down the details before you get there. That way you can tell the doctor everything that's going on and they have all the information that they need because the more information they have about what's going on with you, the better. And the more concise you can be, the better. Know your past and present diagnoses. Again, a lot of times you might have been with a doctor for a long time, so they already have your medical records, but especially if this is the first time you're going to see somebody new, you want to make sure that they have as much possible information as possible. And if you don't have it all straight, because I know sometimes um, it might be difficult if you have a complicated past history to keep everything straight, then provide that doctor with the name of your previous doctor so that they can get it directly from them. And then it's also good, as I mentioned before, that if you have a relationship with a previous doctor, you're now with a new doctor, you can go in and access your patient portal, right? And you can pull down that information yourself directly and take it to the new provider. And so overall, with that first tip about don't be a patient, we see that people who are their own advocates are more satisfied with the care that they get. So it's like you get more when you are more engaged in your care, you get better care. And we have to believe that we deserve the best and again, have that attitude of expecting the best. Great. I see someone else put in a patient is not being listened to. The patient is being ignored and treated as though she's not important. Great. Thank you, Kalita, Kimberly, and Cynthia for those observations. So let's go on to tip number 2. Know what to ask for. Okay. And so these three concepts associated with knowing what to ask for. Expect more from your doctor, ask the right questions, and always get copies. So let's dwell on each of these a little bit. So I put this in there. I'm a big Denzel fan. For those that may not be in my age group or generation, I put uh Jesse up here. I can't remember his last name. As a younger doctor. But the point of this slide is um Williams, thank you very much. The point of this slide is, don't just look at the exterior, right? You got to make sure that you're expecting the right behaviors from your doctor. And those right behaviors actually more have to align with your value system, what you're looking for in a doctor. So you want to look for those doctors that have that relationship with you that you're looking for, right? Yep, Denzel and Saint Elsewhere, exactly. And so, one of the ways to sort of check up ahead of time, if you're looking for a doctor, obviously use word of mouth. That's a great way to sort of find out from your friends, especially if you're moving to a new area, asking people, who do you see? Who's your OBGYN? Who's your family medicine doctor? Who's a good pediatrician? That's one way to do it. Another way is there's a website called reportcard.ncqa.org, and it's just what it sounds like. It gives rankings of health plans if you're trying to choose a health plan. It gives rankings of healthcare clinicians and practices if you're trying to choose a practice. And then other healthcare organizations might include things like rehab facilities or nursing homes. So I'll just go back. So you can actually search by zip code, etc., to find and understand who the doctors are that they recommend and practices in your area. And then I say seeing a doctor is like speed dating. Okay. So you're setting up a relationship with somebody. And so you want to make sure that they adhere to your criteria. So, do they have good listening skills? When you talk with them, do they seem to be paying attention to you? And if they do have to get interrupted, do they apologize and then come back to you? Um, and closely related to that is their attention span, right? Are they staying focused on you in the interaction? When you tell them something that is very personal to you and maybe adverse, something challenging that you've gone through, do they seem to relate to you with compassion? Or if they give you news that you might not want to hear, do they appear to be empathetic? For some people, this is really important, right? For those individuals who might go to a chiropractor or use acupuncture or Reiki, um, are they open and non-judgmental when it comes to other healing practices? And then that crucial point that I talked about before around breaking concepts down so that a non-medical person can understand it. Do they use simple language? Because again, that is going to be crucial for the success of your ongoing relationship. You got to be able to communicate. You got to be on the same page. And then, of course, that without simple language and that great communication, you can't have the shared decision making that we talked about before. Because if you don't understand what the options are on the table and what the risks and benefits are explained in plain language, then you're not going to be able to make choices that are going to be the right choices for you. And then the last one is knowledge of your limitations. And I admit when I was a young gun, young doctor, just starting off, it was hard for me sometimes to say I don't know, right? If somebody asked me a question, but then you learn humility over time, and you know that it's more dangerous to try to give an answer that you don't know the answer to than to be honest and just admit that you don't know, and that you'll try to find the answer if it's appropriate, or direct the person to the correct resources where they could get their question answered. And then I'm gonna move forward to this because I think this will be more helpful than those individual ones. These are the 5 must ask questions that you have to ask your doctor at each and every visit. You got to be able to walk out of that office and know the answer to these 5 questions. The first one is if you went to them, it wasn't just for a checkup, it was, because something's bothering you. You want to ask them, what's wrong with me at the end of the visit, right? A lot of people leave out a visit and have no clue what the doctor is thinking. And that's really the doctor's fault. So I would say um, you you got to ask what is wrong with me. And if they don't know, because sometimes they don't, like they're going to send you for an X-ray or they're going to send you for more for some lab testing, for example, right? So you should then ask them if they're not sure, what are the top 3 things you think are going on with me? And what are you trying to rule in or rule out with the tests that you're getting? Okay, so that's what's wrong with me. The second is, um, okay, the second one is, what do I need to know about the treatment? What you're about to give me, right? Or prescribe for me, that I have to take. So this specifically has to do with procedures that they might do to treat something, and especially medications, right? So you want to know, how soon is this going to kick in? That's the effects, right? Because not all medicines work like taking a Motrin or taking a Tylenol, right? That's going to clear up your headache in the next hour. Um, some medicines take a couple weeks to build up in your system. For example, an antidepressant. And so if you're expecting a quick, 1 to 2 hour effect, when you take it and nothing happens, you're like, and then you take the second one and nothing happens, you're like, this doctor didn't know what they were talking about. But if they explain to you, look, this is going to take a couple weeks to kick in, just stick with it. And then around 2 weeks, you're going to start to see a difference. You're going to be more likely to stick with it because you understand what the effects are. The converse is true on the side effects. So those are the unintended or unwanted effects that a medicine might have. You should know what those most common ones are. You can either get that from your doctor or you can get it from your pharmacist when you go to pick up the medicine. Oftentimes, the pharmacist actually is much more knowledgeable about the broader possibilities from a particular medication, even than the doctor might be. So important to understand those side effects. So when you start to take it, if you experience it, you can immediately let your doctor know, and then together you can decide, is this something that's worth, is the juice worth the squeeze on this, or I need to stop this right away and we need to look for an alternative. And then finally, the cost. We talked about cost before being a potential barrier, right? Like if you can't afford it, you're not going to take it. So you should know upfront from your doctor, look, is this going to be expensive? Is my insurance going to cover this? And then the next thing you want to ask is, well, what are the alternatives to what you want to do? Because there's always, and I say always, an alternative. Even if the alternative, like I said, is doing nothing, you should know, what is the cost or what is the price of doing nothing? What is the potential outcome? Because then you can make a decision that's informed about what course of treatment makes the most sense for you, given your own values and your own conditions and circumstances. The fourth question is, what are the next steps? That means when I leave here today, um, what's the next thing? You wanna see me back? How soon do you wanna see me back? Do I need to make that appointment, or is your staff gonna make that appointment? Do you want me to see a specialist? Again, same thing. Are you making that appointment? Do I need to make that appointment? What's their contact information? Do you want me to get an X-ray? When is the surgery? Those are the next steps, and you should always have a next steps. And then finally, what do I need to do at home? Because, 80% of the success of your treatment plan, your care plan that you work out with the doctor, is probably going to depend on how well you execute it. And so, let's say again, you've been diagnosed with high blood pressure. Um, what you need to do at home, the doctor may say, well, in addition to taking your medicine, I want you to cut down on the salt in your diet. Only add salt, after you've cooked your food, or not at all, right? So you want to know exactly what those self-care things are that you need to be doing to maximize the success of your treatment plan. So those are the 5 questions you should be asking your doctor after each and every visit. And then the last of the 3 is, always get a written copy of your test results. And when you get them, ask for an explanation. And I'm just going to briefly digress and tell a story about my father-in-law. And I'm probably going to be telling a lot of stories about my father-in-law because he had multiple medical problems. So he was often interacting with the healthcare system, and I always got his permission before I told any story. But um, his life and his example and the things that happened to him taught me so much, and I owe him so much for being able to be with him on his healthcare journey. Um, so he had a stroke. I probably shouldn't let that out the bag so quickly. He had weakness on one side of his body. We took him to the emergency department. The emergency department physician got a CAT scan. Okay. Um, and then I spoke to the emergency physician and he told us that the CAT scan was normal. Well, I had just finished writing this book, excuse me, doctor, and I had this in there about always get a written copy of your test results. So I asked the nurse, "Hey, can we see a copy of the CAT scan result?" So she actually had the computer right there. She turned the screen around and showed it to me and my husband, and it said, basically in medical terms, um, this patient has had a stroke. Essentially, the reading of the CAT scan by the radiologist said stroke. And so I went back and I asked the emergency physician, I said, "Hey, wait a minute. You said that um, he didn't have a stroke. And that's what the CAT scan said." And he said, "Oh my goodness, I got your the patients confused. I was talking about another patient." Now, I'm an emergency physician. I can understand that in the confusion of the emergency department, you're taking care of 25 people at the same time. I can understand, how that might have happened. Um, and that's all the more reason why there need to be checks and balances and systems for those things not to happen. And that's what the responsibility of the emergency department. But this one little tip of your doing this and asking for a written copy of your test results and an explanation of it can help to circumvent those kinds of things falling through the cracks. All right, so we covered tip one, don't be a patient patient. Tip two, know what to ask for. This is tip three, do not go it alone. So, another little poll. What are the reasons to not go to a doctor's visit alone, and especially not being hospitalized? A, to help make sense of and remember what the doctor says. B, to ask clarifying questions. C, to provide support in telling slash remembering the whole story. And D, all of the above. So A, B, C, or D. All right, Cynthia was on it with D. Think we're getting D's, Rita, Kalita. So yes, absolutely. All of the above are all excellent reasons to not go it alone. And I like the little um, meme on the side there, nagging. If all else fails, try saying it louder. So there's strength in numbers, right? So that's tip number three. Tip number four, know the members on your healthcare team. And this is especially true, again, this is not necessarily for people that are well and don't have any medical problems, but once you start to develop one or two medical problems, you're probably going to end up going to more than one doctor or more than one different kind of healthcare provider. And actually, I just heard a statistic today, 76% of adults over 30 have one or more chronic medical problems. A staggering amount of people. So you want to know who your primary care physician is. That's the person who is supposed to be sort of the quarterback of your care. They might not know everything about you if you have, um, or they might not know everything about a particular disease, especially if it's complex, but they know about everything that's going on with you. And so they will refer you to a specialist if you need specialty care for your particular challenge. A nurse case manager or a social worker. So this often happens if you've been hospitalized and I mentioned before, sort of the screening process around asking people about their personal history, their social history, what social challenges they may have. A social worker will help you on the spot address some of your healthcare needs or some of your social needs that might be serving as a barrier to your, again, being able to carry out the care plan when you leave the hospital. And the same for the nurse case manager oftentimes helps you in the discharge process when you're leaving the hospital. The other time you might have a nurse case manager or a social worker, let's say you have, unfortunately, if you have cancer, for example, a nurse case manager might be helping you navigate all your cancer care appointments, your chemotherapy, and sort of navigate the team of people that are taking care of you, helping you set up your appointments, etc. Medical specialist, I think that's pretty self-explanatory. So if you have asthma, you might go to see an allergy specialist or a lung doctor. Um, if you're a woman of reproductive age, you're probably going to see a OBGYN. If you have diabetes, you might be going to see an endocrinologist. So know who those people are and the role that they play on your team. Your pharmacist, invaluable. Develop a relationship with your pharmacist. Ask questions about the medications that you prescribe. They're a wealth of knowledge. Um, a health navigator or peer support specialist. So this is sort of some in some areas a very new phenomena. You might have also heard the term community health worker. These tend to be people who are lay people just like you. They don't have a medical background, but they have a lived experience. So a lot of times we see peer support specialists and people who have substance use disorders or addictions, and these are people who who have successfully managing their substance use disorder and now want to give back by being a peer support specialist to somebody who is going through that same journey. Um, Community health workers often now are part of care teams. They do home visits, and they might just, for example, teach you how to take your blood pressure or help you make your doctor's appointments. We often see them in what are called free clinics or federally qualified health centers, if that's where you get your care. Nutritionist, so important, and also a great resource. I would advise anybody who has been diagnosed with a um, nutrition related condition. So, obesity, high blood pressure, diabetes, heart disease. I would encourage you to ask your provider to give you a referral to a nutritionist. Oftentimes, your insurance will pay for it. You can call them and ask ahead of time if they will. And they often can help you work out a meal plan that will help to, again, food is medicine, treat your condition in a way that you may even ultimately be able to come off of medications. And a lot of times that is, as you remember from the first session, we talked about, some foods that are inflammatory, and inflammation is the root of all chronic disease. So by changing your diet, you're decreasing your inflammation, you're helping your chronic condition get better. And then finally, your rehab team, so important. So if you've had an injury, if you've had a stroke, if you've had heart failure, anything, if you've been in the hospital for a prolonged period of time and you're just deconditioned because you haven't been using your muscles, you've been laying in the bed for a long time, your rehab team, a physical therapist, an occupational therapist, um, a speech therapist are all potential members of your team. And speech therapy is more than what it sounds like. People who are having early stage dementia can get speech therapy because speech therapists can help them with techniques to help remember things and jog their memory. They also do swallowing evaluations on people that have had strokes. So speech therapists do more than what their name sounds like. So that's know your team. And then finally, in the home stretch here, tip number 5, make sure that your wishes are honored. Tomorrow's not promised to us, right? And so it is really important that we all have on record what how we would want to be treated if for some reason we got incapacitated. Um, a dear friend of mine's 25-year-old daughter had a seizure for the first time. No idea why. And most seizures, first time seizures, about um, 70% of them, they never actually find a reason, the exact reason why. But so she had this seizure, and see, she had just eaten a bowl of an acai bowl that has like little C's in it. So when she had the seizure, all that food came up from her stomach and went into her lungs. And she essentially had a massive inflammatory reaction in her lung, developed something similar to pneumonia, but worse. You know, her entire lung was inflamed. She had to be put on a ventilator, and she almost died, honestly, at 25 years old from something totally unexpected. She had been previously healthy. And all that's just to say that at that point in time, because she was, on all these sedatives, because she was on the ventilator, she was basically unconscious for 3 weeks. She couldn't express what she wanted her wishes to be. So, all that to say, it's really important to have these next things in place that I'm going to talk to you about. The first is a healthcare proxy. That is somebody who's a representative, a surrogate, or an agent, somebody who you trust. This is really important. Somebody you trust to make healthcare decisions for you if you're unable to communicate. This is a simple legal document. You can actually, probably go to the internet and find one of these legal softwares and download it and write this up, or have a lawyer write it up for you. Um, and have it with you, have it known, have the person who you're designating as your health care proxy know that that's their role. Like, who is the best person to be a healthcare proxy? Somebody that you trust, and somebody whose personality is one that they're going to advocate for you and ask questions and represent your wishes. So that might not necessarily be your spouse, right? It might be your sister or brother or your best your BFF, right? Um, so think about that. Let them know, ask them for their permission in doing that, and then let them know ahead of time, and then let them know your wishes so that they can represent those, right? Maybe you're not somebody who would want to be kept alive for weeks, months, years on end, depending on a ventilator and lying in bed. And you want to communicate that. That's really important that that person knows how to represent your needs. And so, again, in choosing that person, you want to know, will this person honor my wishes and do as I ask if needed? Am I comfortable talking with this person about my wishes? I mean, this is very deeply personal thoughts as to what you would want in case of a medical emergency. Do I trust this person with my life? Because essentially that's what you're doing. Can this person handle conflicting opinions from my family, friends, and healthcare providers? So they have to have a sort of a strong will, strong personality. And if the person doesn't live near you, would they be able and willing to travel if needed in that instance? And then an advance directive basically makes your healthcare proxy's job easy, right? It is actually a document that provides instructions for your medical care, and it only goes into effect if you can't communicate your wishes. So if you have it written down, people don't have to guess, right? Your family is not going to have an argument. Your healthcare proxy can say, well, it's written right here in black and white. This is what he or she wants, right? So having that advanced directive document is really, really helpful to, again, make sure that in the event that anything happens to you where you can't communicate, that everybody knows and is on the same page about what you want. It's also called a durable power of healthcare attorney or a living will. Those are other names that you might hear for an advanced directive. So I will stop there and take any questions. Um, Thank you all for being here. Again, the fact that you're here tells me that you're already empowered healthcare consumers, that you want to be um, on that level of, knowing what you want for yourself and for your healthcare and how to advocate for it. So I'll stop there and take any questions.
So thank you, Dr. Clarke. I appreciate all the knowledge that you dropped on us today. Um, so we don't have any questions in the Q&A box. I don't know if there are any questions in the chat, and I know we're running short on time, but I did want to address one thing because this is all, I think what we go through at least once a year when we go for our annual checkup, and we get our blood work done. And you talked about asking for test results. And so I have gotten in the habit of doing that because I think it's important to know kind of the range that's on your report or the results and what that really means. And so what I do, there are certain things that I want my doctor to test that aren't part of the normal blood panel. But can you talk about things that, especially for us, and maybe looks like the majority of the folks that are on the call today are women, and
Yeah.
especially when we get to a certain age, what are the things that we should be asking our provider or PC to include in the blood panel for our annual checkup?
Yeah, definitely. Great questions. So, the standard blood panel looks at your blood cells, the quality and the quantity of your blood cells, and can diagnose things like anemia if you have low red blood cell count, um, things like cancers of the blood, etc., infections. So that's the blood count. There's a separate panel of tests that are grouped together that are called your chemistries, and it actually tests your kidney function, how well your kidneys are working, and then your electrolytes, your sodium, your potassium, just to make sure that those levels are normal. And then beyond that, you should also be thinking about the health of your thyroid. A lot of times, people are, you know, unknowingly they develop thyroid disease, which can present in different ways, and the connections might not be made. So asking for thyroid tests are important. Um, Asking for a CRP, that is a measure of inflammation, right, in your body. We talked in the first session about inflammation, and if you have high inflammation in your body, it doesn't necessarily point to a specific disease, but it can tip the doctor off that something else might be going on, or just that you need to start really focusing on those 5 self-health actions so that that inflammation doesn't then spiral into something like diabetes or rheumatoid arthritis, or some chronic disease down the line. Um, in addition, I would also say ask for a hemoglobin A1C, or just a test for diabetes, right?
Right.
Very important because you can have diabetes walking around and not even know it. So those screening blood tests are really important to ask for, a hemoglobin A1C or a test for diabetes. Um, they also always should get um, your weight, and your waist circumference,
Mm.
to and height to calculate your BMI, to let you know in terms of your weight and where it should be ideally, and of course your blood pressure.
Okay. Thank you. I know we could have a whole conversation about BMI and especially in Black women, but we maybe we can save that for
Well,
another.
waist circumference is more accurate than BMI, so that's why I said waist circumference.
Great. Okay. So I know I want to respect everybody's time and especially yours, but I really do appreciate you being here today. I don't know if you have any parting words, any final thoughts when we talk about becoming an empowered patient that we need to know before we all leave today.
I just want to say, again, it's more important than ever now with the uncertainty in our healthcare system, uncertainty of coverage for people, that the more you can take control of your health. And when you have to interact with the healthcare system, doing so in an effective way, it's even more important now. So thanks for this space and for all the work that you're doing. And
Okay.
thanks to the audience for tuning in.
Okay, thank you. Have a good evening. And I just, for all of you who can stay, I just have a few more things to go over before we say goodbye today. So Sylvie, if you can share the screen again, that would be great.
All right. Thank you, everyone.
So for those of you that are still here, we would love to hear from you about the session today. So please take a moment to scan the QR code here to provide your feedback on the evaluation. So I'll just wait a few seconds, and I'm not sure if the link is in the chat also. But please do take a moment to let us know what you think. If you have any thoughts about what else you need to hear or would like to hear from us about really making the healthcare system work better for you, that would be great. Okay, next slide. So just a reminder that we have another session coming up, session 3 next month on August 27th at 2:30. It is called really knowing your healthcare providers and your team and how you should be really cultivating a relationship with them. So that is important for us to do as part of being an empowered patient. So just a reminder, please tune in on August 27th. We'll be sending information out, but you can go to our website to the events tab, and in the drop-down menu, you'll see current events and you'll be able to register there. Next slide. You can also support us so that we can continue to do this work and support our community. You can join the Campaign for Black Health Equity. You can connect with us and follow us on social media. So we're not so much on X anymore, but we are on all of the other social platforms. So Facebook, LinkedIn, Instagram, and also you can look at all the videos from our webinars on our YouTube channel. So I think that's it. And thank you all for coming today. And please don't forget to fill in the evaluation form. Have a good afternoon. Bye.